According to an annual government report, the Social Security Trust Fund that most Americans rely on for their retirement will actually run out of money in 12 years. That's 1 year sooner than expected. That is really ridiculous, folks. And it's crazy to think of that. On the top of that, as time passes, senior citizens and all Social Security recipients could see their retirement payments shrink and healthcare costs increase. The Treasury Department oversees two Social Security funds, the Old Age and Survivors Insurance and the Disability Insurance Trust Funds. Those programs are designed to provide a source of income, respectively, to former workers who have retired at the end of their careers or to those who cannot work due to a disability. Officials said the Old Age and Survivors Trust Fund is now available to pay scheduled benefits until 2033, 1 year earlier than reported last year. The Disability Insurance Fund is estimated to be adequately funded through 2057. That's 8 years earlier than in the report published in 2020. Now, Congress, everybody, should make Social Security beneficiaries their top priority. But the government, folks, has already been making some important changes, at least for 2022. Here are the 4 changes that I was talking about, and here are the 4 changes that you should be aware of, whether you're already claiming Social Security or plan to sign up later this year. And even if you're still working and planning on receiving Social Security benefits in the near future. Number 1 is that you have to wait longer to qualify for your benefit. The SSA assigns everyone a full retirement age based on their birth year. This is when you become eligible for your full Social Security benefit based on your work history. For adults turning 62 in 2022, their full retirement age is 67. This is 2 months higher than the full retirement age for adults who turned 62 years old in 2021. Now, it doesn't mean you have to wait until year 67 to sign up, but if you apply sooner, you will get smaller checks. Signing up right away at age 62 means you only get 70% of your full benefit per check. On the other hand, you can delay benefits past your full retirement age, which will increase your checks. You can get up to 124% of your full benefit per check if you wait until 70 to apply. Now, a popular misconception is that you will still owe Social Security taxes on more income. For most people, that's true, but for high earners, only some of their salary helps. In 2021, you paid Social Security taxes on the first $142,000 that you earned. In 2022, this limit rises slightly to $147,000. Also, a big change is that you will get larger Social Security checks if you're already claiming the Social Security 2022 COLA, which is one of the largest increases in recent years. Checks will also grow by 5.9%. That's an extra $92 per month for seniors who qualified for the average $1,500 in monthly benefits back in 2021 last year. Now, folks, although this sounds like a good thing, the extra money is not going as far as lawmakers had hoped. The reason the COLA is so large this year is because inflation is high. So the extra $92 a month will probably go toward helping you cover the increased cost on your everyday items. One thing I know for sure is that President Biden has to realize that the American people are still in need of financial assistance and that a fourth stimulus check has to be approved before it's too late. If you guys agree with me, tell me in the comments down below.
But let's just focus first on healthcare and trying to address the issues of those that continue to struggle to access and afford healthcare. I'll just remind you, past actions, no one else in the country, no other state in America has done more in this space than the state of California. It's a point of pride in the last few years in particular. It's a point of pride and passion as well. That said, we're not nearly where we need to go. And that's why we'll talk about our new investments, but just briefly, middle-class tax investments. You may recall the middle-class subsidies we did a couple years ago. No other state had done that. Interestingly, because of Nancy Pelosi's leadership and because of the president's leadership, they are actually now subsidizing that space. So we have roughly 300, Keely will clean this up perhaps after the presentation, but $333 million of savings because we don't have to fund that middle-class subsidy that we'll be putting into a reserve fund to expand other subsidies. But it's important to remind people that we were the first state to do that. We expanded ACEs screening and dementia screening. That's $135 million over 3 years alone. We launched CalRx and Medi-Cal RX this year, and I'll talk a little bit more about a preview for next year to attack the issues and costs associated with prescription drugs. And we expanded coverage for people regardless of immigration status, young and old alike. This year, here's what we're proposing to do. We struggled last year a little bit, and I'm not shy to say that, and I'm actually really proud because we had a great conversation with the legislature on creating this new Office of Healthcare Affordability to address underlying cost drivers, compliance, integration, again, of primary and behavioral health issues that we all share. I'm looking forward to getting this office done. It's been stubborn. It would have been done before if it was easy. So we are proposing to get it back this year. Here on the CalRx, insulin. So we decided just to chunk this thing down. How can we lay the groundwork to start manufacturing, or at least partner with manufacturers to do our own branded pharmaceuticals? We're just too big not to do that. Private sector uses leverage. We should use private sector considerations to leverage our purchasing power. Now, we've done that with private sector folks that now can join the state plan. That was part of the original CalRx and original executive order that I signed. I think that was one I signed on the first day in office. But we've been focusing on a partnership. You asked me about it. I'm not going to share any details until we're ready, but I wanted to preview it. And that's to contract and manufacture our own insulin at a profoundly reduced cost. I'm so excited about this. Can't wait to share more detail. And full disclosure, I don't think my staff was particularly pleased that I even offered this much information. But I wanted to lean in because I want you to know we mean business in this space, and I'm not walking away from that long-term commitment to get pharmaceutical costs down in the state of California. And by the way, I think insulin epitomizes the failures in the pharmaceutical industry. It just, in every way, shape, or form. And that's why we're targeting insulin, and we've got a potential partner, and looking forward to advancing more information in that space. Look, more things we've been doing and things that we're building on this year, part of the California Blueprint moving forward. We have more ideas, and Keely can walk through the details, to reduce premiums for pregnant women, children, new moms, those that are disabled. A lot of investments in the reproductive space, more flexibilities, more investments in terms of security broadly to provide safety and security and access to reproductive health in this state. We're looking to more investments, providing more equity for provider payments, particularly for preventative care that has been impacted by COVID profoundly. So real investments in that space. And opioids. I talked a few weeks ago, I'll talk very briefly about it in public safety slides coming up, around what's happening with fentanyl in this nation, what's happening in this state, this opioid crisis. A disproportionate focus of those resources, $182 million, will be in that fentanyl space. And we also will be focused not just on medication-assisted treatment, but also on issues of enforcement. But here's the big one. California is poised to be, if this proposal is supported, the first state in the country to achieve universal access to health coverage. So what does that mean? It means full scope Medi-Cal